Okay, hi everyone. I want us to look at a full hemogram test. This is a very common test that is done as a routine test, one of the basic tests that is done in our health facilities to most of the patients who visit the hospital setup. The full hemogram test is also known as the complete blood count. So it's a common test, as you can see, and its function is to evaluate the overall health of a patient, and therefore helping the doctors to detect a number of conditions such as anemia, infections, inflammation, bleeding disorders, and blood cancers, among others. So it analyzes the blood cells. This is just the systems that are found in the body, but we look at the cardiovascular system because that is where our concern is. Cardiovascular system itself, it has components, and there are three components of cardiovascular system. That is the heart, the blood vessels, and the blood itself. So when you look on this diagram here, is a pictorial representation of the circulatory system. What you see in the middle is the heart. What you see up there is the lungs. What you see down here is the human body. What you see in blue is blood without oxygen. We call it deoxygenated blood. Deoxygenated blood. And what you see in red represents oxygenated blood. So the circulatory system has two circuits, the pulmonary circuit and the systemic circuit. So when we take this side here, blood that has no oxygen is being pumped through the pulmonary artery from the right ventricle through the pulmonary artery to the lungs to collect oxygen. And once it has collected oxygen from the lungs, it comes back into the heart, that's the left atrium, through the pulmonary vein, goes down into the left ventricle, and then it's pumped through the aorta to the entire body. That is where now oxygen is consumed, and once oxygen has been consumed, blood without oxygen, what we are referring to as deoxygenated blood, is now taken back into the heart via the vena cava into the right atrium, down to the right ventricle, and then pumped again to the lungs to collect oxygen, and the circuit continues. So that marks a summary of the circulatory system. So let's look at blood. We have components of blood, that is plasma and blood cells. So plasma of the whole blood, plasma takes 55%, while the blood cells takes 45%. In plasma, we also find components like plasma proteins, such as albumin, globulin. You can also find blood gases in plasma, electrolytes, hormones, among other components. So let's look at types of blood cells. There are three. We have the white blood cells, red blood cells, and platelets. Red blood cells are also known as leukocytes. The white blood cells are also known as leukocytes. The red blood cells are also known as erythrocytes, while the platelets are also referred to as the thrombocytes. So all these blood cells are produced in the bone marrow, that is in the adult people. And then in the embryonic life, these cells are produced in the yolk sac. And then in the fetal life, the blood cells are usually produced in what we refer to as the liver or the spleen. So we are saying blood cells are produced in the bone marrow, that is in adult people. Blood cells can also be produced in the yolk sac, that is during embryonic life. Blood cells can also be produced in the liver or the spleen during fetal life. So these are the pictorial representation of blood cells. You can see the neutrophils, eosinophils, basophils, lymphocytes, and monocytes represent white blood cells. And then we have the platelets here and erythrocytes. What you need to remember is that sometimes these platelets are just referred to as blood fragments because they are not actually true cells because they lack the nucleus. Erythrocytes are just red blood cells. Another thing you need to remember is that the white blood cells has got two categories. We have what we call the granulocytes, and then we have what we call agranulocytes. So what is the difference between the two? Granulocytes have granules in the cytoplasm. You can see up here. And therefore, the granulocytes are just neutrophils, eosinophils, and basophils. When we talk of agranulocytes, these are white blood cells that lack granules in the cytoplasm. And these are just two, that is the lymphocytes and the monocytes. So we have already mentioned the production of blood cells. They are produced in the yolk sac, that is during embryonic life. They are produced in the liver or spleen during fetal life. They are produced in the bone marrow after fetal life. And they come from what we call hemopoietic stem cells. So hemopoietic stem cells, for example, if we talk about the bone marrow, these are the cells we refer to as multipotent cells. Multipotent meaning multipotential. They have the multipotential to differentiate into different blood cells. Therefore, we start from what we call the hemopoietic stem cells, and then we have two lineage, what we refer to as the myeloid lineage. And then we also have what we call the lymphoid lineage. So from the myeloid lineage, we get the red blood cells, we get the neutrophils, we get the basophils, we get platelets, we get monocytes. And from the lymphoid lineage, we get T and B lymphocytes. We also get what we refer to as the natural killer cells. So that is basically how these cells are produced from hemopoietic stem cells to differentiate into different types of blood cells. So this is just a repetition of what we have already mentioned. From myeloid lineage, we get red blood cells, platelets, neutrophils, basophils, and eosinophils. From the lymphoid lineage, we get B and T lymphocytes together with the natural killer cells. So what are the functions of blood cells? The white blood cells, they protect the body against infections, including foreign substances and abnormal cells. What you need to remember is that different types of white blood cells are specialized to perform different roles. As you have seen earlier on, we have different types of white blood cells. So generally, they play a role in protecting the body against infections, foreign substances, and abnormal cells. But when you narrow down, you find that every type of white blood cells is differentiated to perform specialized functions. The function of the red blood cells generally is to transport oxygen from lungs to tissues, the way we had seen in the circulatory system. They also transport carbon dioxide or carbon dioxide from the tissues back to the lungs for excretion. Remember, we have four excretory organs in the body. That is the lungs, the liver, the skin, together with the kidneys. So the lungs come in as excretory organs, and that is when it comes to excretion of CO2 from the body. So a full hemogram sample will include the name of the patient. It will have what we refer to as the date of the test, the age of the patient, and the gender. So the red blood cells, the normal count is 4.80 million per microliter. That is in normal patients. So the range is 4.5 to 5.9. Remember, the red blood cells contain hemoglobin. That is the protein on which gaseous molecules bind. That is oxygen before it's transported in the circulation. So whenever you have a deranged value of the red blood cells, for example, if you have a number that is low here, then we are talking of anemia. So the white blood cells count together with the differentials. The differentials are just neutrophils, lymphocytes, monocytes, eosinophils, and basophils. The general white blood cells count is about 8,500 cells per microliter, in which the normal range is 4,000 to 11,000 cells. So when we come to the differentials, we look at the neutrophils. This is the abundant cells, group of white blood cells. They take about 65%, and the normal range is 45 to 75. The lymphocytes, they take about 25%, therefore they're the second in that order. Their range is 20 to 40. They are actually followed by monocytes, which account for 8%, eosinophils 2%, basophils almost 0%, with a normal range of 0 to 2. So this forms the differentials of the white blood cells, and each differential has a specific role in the immune system. When we talk about the platelets, we are saying that the platelet count is 250 times 10 raised to power 3 per microliter, and the normal range is 150 to 450. So we can see here, generally a full hemogram will help you to diagnose anemia. It will help you to diagnose infections. It can also help you to detect inflammation. It can help you also to check for blood disorders, immune system problems, among other disorders. So when we look at an individual type of blood cells, we start with the red blood cells. And when you do a full hemogram, we have just 3 outcomes. You either have an H, you have an N, or you have an L. So H stands for high, N stands for normal, while L stands for low. So when you do a full hemogram, after analyzing the blood cells, the results just indicate one of the three, can be either high, normal, or low. So if the red blood cells are low, then it means we are talking of a condition we refer to as anemia. And when you do a full hemogram test and the result of your red blood cells is high, which is indicated with H, it means this patient is likely to have what we call polycythemia, or he can just be having what we call hemoconcentration. One of the causes of hemoconcentration is dehydration. So if a patient is dehydrated, he can likely to have hemoconcentration, and therefore your RBCs will be high. So in that case, we look at what we refer to as the PCV, which is just packed cell volume. Packed cell volume. So in this case, your packed cell volume will be high. Sometimes we also refer to it as hematocrit. Hematocrit. When you look at the white blood cells in general, when they are low, the condition is called leukopenia, and it actually signifies a reduced immune defense of that patient. That is, when the general white blood cells generally are low, then it means there are chances that the immune system of this patient is compromised. Generally, when the white blood cells are high, this condition we normally refer to it as leukocytosis, and it can be pointing to issues like infection, inflammation, among other conditions. So when we look at the differentials of the white blood cells, then we can start with the neutrophils. When the neutrophils are high, then there are high chances that this patient could be having a bacterial infection, or this patient could just be in a stressful state. And when the neutrophils are low, the chances are this patient could be having a high viral infection, or it could just be a bone marrow disorder where these cells are produced. When the lymphocytes are when the lymphocytes are high, they also indicate the patient could be having a viral infection, sometimes also TB. And when the lymphocytes are low, then these patients will be having a chronic disease. Example of chronic viral disease is HIV. And also the patient will be having steroid therapy. Maybe there's a patient who is on management of some conditions using steroids. Also, when the lymphocytes are low, it can mean that this patient just has got a severe illness. The eosinophils, when they are high, they indicate allergies and also parasitic infections. The commonest allergies we encounter in practice is asthma. Others include allergic conjunctivitis. I also have dermatitis, among others. And then when the eosinophils are low, then the patient will be actually in acute stress, or it can just imply that this patient was having a recent infection, or the patient is also exposed to steroids. Then let's look at monocytes. When the monocytes are high, they normally indicate a chronic infection. Sometimes it also means that the patient is having an autoimmune disease. Autoimmune diseases are just diseases where the immune system attacks its own tissues. When the monocytes are low, then we are talking of things like acute infection, also stress response, steroid use, or just bone marrow suppression. When the basophils are high, It can also indicate an allergic reaction or chronic inflammation, a condition also referred to as hypothyroidism, chronic myeloid leukemia, among other conditions. And when the basophils are low, it also means the patient could be having also an infection. It can also be an indicator in pregnancy, which means when female patients are expectant, the basophils may also be low. So the count of basophils can be low in patients who are expectant because of a number of immune processes going through into the body. So sometimes the low basophils also indicate steroid therapy, together with hyperthyroidism, among other conditions. So when we look at the platelets, the high platelets indicates a high risk of clotting. That condition is called thrombotic events. One of the thrombotic events is DVT and stroke. DVT is just deep venous thrombosis. So when you do a full hemogram and you find your platelets are high, then you have a high risk of clotting disorders. That is, example one is DVT and the other one is stroke. So the possible cause of high platelets is inflammation, infection, and myeloproliferative disorders. The low count of platelets just indicate a high risk of bleeding for these patients. Mostly possible causes could be the dengue fever, a very common infection at the coastal area of Kenya. Can also be due to malaria. So these two tropical infections are the commonest possible causes of low platelet count. So that marks the end of our presentation today. You can subscribe to our channel. It's called Optics and Eye Health channel. The handles are indicated as above. Thank you. Let's meet in the next presentation.